Thanks for tuning in to an American Ambulance Association webinar. This webinar is being recorded. The recording link and slide deck will be published in tomorrow's digest for AAA members. To ask questions, please use the Q&A function in Zoom, represented by the double dialog bubble button, or simply enter your questions into the chat. Thank you again for joining us, and with that, it's my pleasure to introduce today's presenters, Scott Moore and Dr. Lau Morrison. Scott, please take it from here.
Thank you very much, Amanda. Appreciate it. I appreciate all of you who are in attendance. This is what was or intended to be multiple webinars that we were doing. We started this series really probably, I think, 2 or 3 years ago during the pandemic. And just this series is intended to be more of a dialogue. And what I mean by that is we'll be watching the chat and we'll certainly be watching the Q&A so that if you want to participate, we encourage that and certainly and would love any feedback that you have. And if, of course, your feedback you don't feel comfortable offering, certainly we won't be reading out who necessarily pitched the question, but we will bring your question forward. And then lastly, if, of course, you have questions that you don't want to bring up during or that you think of after, you can always send those questions into hello@ambulance.org, and they will be into our ticketing system, and they will be routed over to me, and then we will I will share that information with Dr. Morrison, and we can hopefully move through. But I want to just quickly introduce my co-presenter, Dr. Lau Morrison, who I have known since 2009 when we worked together at Armstrong Ambulance, one of our AAA member companies up here in the Boston area. Lau at the time was an emergency medical technician and worked for many years on the ambulance. But at the time that I met her, she was in the process of getting, she was in a school at the time, I think the college was called the Mass School of Psychology, correct?
Massachusetts School of Professional Psychology, that now it's called William James College.
Yes, and so Lau was in the process of doing her dissertation, and she had asked if I would participate in the committee. And her research was really, and really all of her professional background and her experience and interest in research and so forth have been tied around EMS. As we all know, once you're in EMS, you can't sort of find your way out of EMS. But currently she serves in a role, a clinical psychologist role with, if I've got that right, with LA County out on the other coast. And I don't know, Lau, if you want to just give a quick little bio background on yourself, because I know I'm going to say you're a superhero. You're going to actually tell them what you technically do, but I know that underneath those clothes there's a superhero.
Probably sounds better when you say it.
Yeah,
I've been working for LA County as a psychologist in a variety of ways, but my primary concentration has been to work with first responders and EMS and their family members. And I've done that through the county and also through my private practice on the side. And I still have been working with the Code Green campaign. I don't know if we're going to be talking about that hopefully in a little bit. And so I've maintained contact with EMS in some way.
And I think part of what I have always appreciated about, one, that you went on to get your Psy.D, and I got that right, your Psy.D. And what I've appreciated is that in your current private practice, where you're focusing a lot of that on people in public safety and EMS, that you actually still are an EMS family. Your husband has worked in EMS for many, many years, but you have firsthand experience about working on an ambulance, know what it's like to work on an ambulance, know what it's like to work both in 911 and non-emergency fields. And then again, have a lot of experience dealing with, as once you're an EMS family, you're kind of an EMS family. So I just wanted to welcome you back. I really appreciate you taking the time. And our goal is, and one of the things I really appreciate about Lau is when we start to prepare for these webinars, we actually spend a fair amount of time down rabbit holes talking about basically every aspect of mental wellness, mental health and mental wellness in EMS and the way that it's impacting our folks. And one of the things that we said is our goal is to have a conversation that you all happen to be present for and hopefully participate in. But recently, and so I've been sort of shifting a lot of what I've been doing as frankly the industry has been shifting towards looking more and more at sort of mental health and wellness. And so last year, 2022, Gallup, who most of us know, Gallup, who has been doing for 25 years, they've been doing research on employee engagement. Gallup, though, also for the last 15 years has been studying happiness. And I know that that sounds sort of funny. And for many of you who attended our annual workshop several years ago, I think it was 2018, our annual conference, Sean Aker, who is a Harvard-educated clinician who has done most of his research around happiness, really sort of talked about how the dynamics surrounding happiness. Well, Gallup has been researching it for 15 years. They put researchers or surveyors in every single country on the globe for the last 15 years. And one of the things that they found is that in their research or surveys, they found that the number of people over a 15-year period, because a lot of folks have talked about this like a crisis, right? That this is something that just suddenly popped up post-COVID. And what we know from some of this Gallup research is, look, the number of people who reported that they were living their best lives has doubled over 15 years, which is wonderful, right? But the number of people who reported that they're living their worst life has quadrupled. So the delta really between those who think they're doing wonderfully and those who think they're not doing so wonderfully really is growing every single year. And one of the contributing factors that Gallup sort of identified as sort of driving some of this global unhappiness has been not only the role of politics, but also the role that social media has played in a lot of this. And so and one of the other things that they sort of talked about was that by and large, global leaders have largely missed it. Now, Lau and I talked a little bit about why are they missing it? Well, because by and large, they were measuring sort of happiness through the lens of GDP and sort of other output measures, which frankly don't have anything to do with happiness. They have to do with productivity. And so one of the things we know is that if global leaders have been missing it, frankly, I think a lot of our workforce leaders have been missing it as well. And what I think and what a lot of folks think really is that a huge contributing factor and what happened, in my opinion, is over the last few years, and I don't know, Lau, if you feel the same way, but over the last few years, what's happened with not only the pandemic, but what's happened with some of the political and other social unrest issues have brought this sort of, have made it so that you can't broad brush or overlook what's going on in our population. And then because we know for a fact that your workforce is going to loosely represent the population that you serve or that you're pulling your workforce from, we know for a fact that this global unhappiness and the impacts of civil unrest and mental health are impacting our staff as well. And so, Lau, you and I talked about this. I don't know if you have feelings on it, but in your private practice, have you seen a shift in maybe sort of a level, maybe not a crisis is the best way to put it, but people's perception of sort of what's happening or maybe of, I don't know if I don't want to use the term hopelessness, but have you seen a shift in the folks that you are engaging?
Yeah, there's definitely a difference in like generational difference, right? I think what our expectations were, back in the day when we were in EMS was kind of, if you can take a minute to sleep, because if you can't, you might not be able to sleep for the next 24 hours, right? It was like we were expecting to work ourselves dry, and the newer generations are kind of more open-minded about like, no, I should have some well-being within my work, right? And in that same way, coming into the clinic, I think it's more often than we see people actually look, start getting interested in mental health and trying to do something about it before it's, more severe. And also there's more people within organizations that are more interested in looking at ways to improve this within their workforce. So it's definitely something that when we started, I don't know if you remember, Scott, we had like maybe there was 3 papers we could quote from, right, around the world. It was like Australia was the only one. And now there's so much information out there that it's definitely
Well,
explored in the last.
actually, I remember when you were doing your dissertation, right? When you were looking for, because yours were your dissertation, as I recall, was regarding sort of coping mechanisms employed by people in EMS, and your search for. And I did research in my undergrad as a psychology major in the perceptions of death and dying for people in EMS, and so what I would tell you was there was no instrument generally that was widely used before and accepted and validated in an EMS context when I did it back in 1999. And I know you struggled, right, in finding instruments and data and research, but thankfully what we're seeing now is a recognition that mental health certainly is an issue, and that in particular, we're starting to see far more attention being paid. And I think a huge piece of that was, right, not only has a chunk of the workforce started working from home, and this is sort of this rebalancing what's important to people, right, that we're working from home. Now, our folks weren't, of course, but a lot of the rest of the planet was working from home, was spending more time with family. And then when it came time to go back to what they had been doing before, their relationship with work had changed pretty dramatically. And they thought, I don't want to go back to what that was before. So I know you and I, when we were preparing for this, we talked a lot about, right, we know if we had looked at mental health resources back 5 years ago, they really weren't, I mean, there were some, but there weren't on the level that there is today. And so this report, right, by the US Surgeon General gets released in 2022, where they really, in this report, and the links, by the way, and the slides were sent to Amanda, and normally, my fault, normally they're shared when that reminder goes out for folks to, the slides are shared so that you can follow along. My apologies, I didn't send them until shortly before the program launched. They will go out when Amanda sends out the link to the recording and so forth. And anywhere you see an underlined resource, that is a link or a hyperlink back to the underlying resource itself. So this report, which we both were talking about, if you get nothing else out of this webinar, what I would say is, like I talk about OSHA resources and the fact that, you know, OSHA's got tons of resources where you can do hazard assessments and that kind of stuff. If you do nothing else, have you and your workforce, and your leadership team needs to take a look at this report that was issued by the US Surgeon General. And this report is relatively new, right? It's pretty current. And one of the things that really came out, and we're not going to spend a lot of time talking about, you know, a bunch of statistics and because I think everybody knows there's a problem, but just to give you an idea, right? Better than 3/4 of the workplace, right, or the workforce is experiencing some level of workplace stress. And of course, as you can see on the screen here, right, that is sort of demonstrated in a whole bunch of different ways. And one of the challenges that I see is that there isn't as much research as it relates to EMS. So even today, as we went out to try and find research tied directly to EMS regarding things like substance use, we will tell you that they just really aren't as readily available. But one of the key, there were 2 Surgeon General reports, right, Lau? I think the second one was specifically geared towards healthcare workforce. Right. Yeah, and then this was one on the general workforce. What I'd say is, please read them both, because we are, of course, part of that healthcare workforce. But this was a comment, Lau, that you in particular keyed in on, and I'd love you to talk about it for a second, if you don't mind.
Yes, absolutely. So obviously, this is just a great quote from the Surgeon General, which, you know, it's interesting because if you look at past Surgeon General's advisories, they have been, you know, about cigarette smoking, about seat belts, and, you know, and the fact that this situation and this concern has now risen to the level of the Surgeon General advisory speaks for itself as well, especially since the pandemic. And so it's interesting because it's not only about looking into helping our workforce for the sake of, you know, he does discuss in detail how it's directly affecting patient care and the ability for the workforce within healthcare to actually meet its needs. But it's also something that we still owe this, health workers a great deal of us, of help. We owe them a lot based on what's been going on through the pandemic. And I think during the pandemic, there was a lot of focus given to their heroes, and there were like the parades. I don't know if you remember, like with like the ambulances would go by, and it was like this whole thing. And that was like, the time has gone on, like these people have had to continue going to work like every other day. And so that's kind of behind them. And so now it's when we're kind of noticing what comes afterwards, and a lot of people leaving the workforce in all levels of healthcare, but particularly within EMS.
Yeah, and I think that we owe them a debt of an urgent debt of action is the one. And so again, one of the comments out of the report was actually from a mid-career EMT, essentially suggesting, like, look, we are also struggling, and we're seeing that when it comes down to the EMS. Now, the AAA released earlier, just about a month and a half ago, we released the 2023 AAA Newton 360 turnover survey. And the good news is, of course, that turnover really has reduced a little bit. It's still on the low end, on the low end of the statistic, 20% turnover rate. On the high end, 31, which is down from the high end of 36 last year. Now, just to give you sort of a preview, this is really very close to what turnover looked like in 2018, right? Which is funny, because I'm going to bet you tangibly turnover feels different today than it did in 2018. However, right, our frame of reference has really changed. And so, we're not stating anything that you don't know is already undoubtedly a problem. And one of the things that whenever Lau and I sit down and go, okay, kind of what's the goal of this webinar? What are we trying to get across to people? It's really this idea that we try and grab one or two things that we think are action items for you, and for you as an attendee. And if you can share this recording with the rest of your staff, by the way, the reason these are recorded are so that you can share them for the rest of your staff. And it's also a great way, right? Again, as you're thinking about professional development and career laddering for your folks, this is a great way to get them information that will really help them in their day-to-day interactions with the staff. Because as I've said to folks, recognize that just like when you're walking into a patient who is expressing that they're having cardiac pain, knowing a little bit about their history is critically important in how you manage and deal with that person. So what our goal is to say, hey, we want to highlight a couple of things during this program that can at least set your frame of reference in how you're interacting with staff, but then also hopefully give you some action items as you move forward. So we're never going to tackle everything that there is to tackle about employee mental health and wellness. Did a webinar on it yesterday with another group, and frankly, although there were no psychologists on yesterday's webinar, what I will say is this is one that when Lau and I started talking about this, that I thought this is something we have to talk about. So I don't know, Lau, if you don't mind, sort of why did this stick out for you? I know why it stuck out for me. Oh, your volume or your for some
There we
reason.
go. I'm back.
Yeah. All right, go for it.
You don't do that, then it's not a fun.
Actually, if I can quickly, let me tell you, many of you or some of you may know that in the context of 2020 and 2021, within about a 3-week period, I had two past coworkers and one current coworker, and I say coworker on my fire department, die by suicide. And when Lau and I started talking about the preparation for this webinar, and this came up, the first thing I thought about was, oh my gosh, I wonder to what extent. Now, I don't think all three of these existed in each one of those people, but I'm confident that a couple of them did. And so I don't know, Lau, if you don't mind sharing, I forget how this came up, but you said you had recently read about the study.
Right. Yeah. So I was reading about a retrospective study about that looked into what are the commonalities among particularly first responders, but it was also the general population that died by suicide. And, there's a lot in there. And I think that one of the things I think we struggle with Scott, and we want to make sure that we don't do, is kind of give the same information that's being given by everybody else. There's so many, podcasts and webinars and everything discussing, resilience. I remember I had a place that I recently did a presentation at, that they're like, whatever you do, just don't say the word resilience. I think people are just like sick of that word, right? But nevertheless, the study looked at three main commonalities among people that died by suicide, and that was they had an underlying depression, they had substance use, and then a recent loss. And now, while these things seem to be very specific, I think it warrants kind of like explaining, because these things could be overseen in day to day. So for example, when we're talking about depression, half of your workforce is likely to have depression to some extent, right? It could be mild depression, moderate, severe. And I think when we all think about depression, we imagine, the person crying in the side of, like just curled up in bed, not wanting to get out. And that's one type of depression, but depression looks, there's a lot of different ways that depression presents, especially within the first responder community. Depression is particularly not as we imagine it to be. It's usually more irritability and looking in other ways. So I think it's important to recognize that. So statistically, we know at least more than half of your workforce is likely to have mild depression symptoms. And so then, and also when looked at that against the general population, in general, first responders have twice the likelihood of having these diagnoses in the general population, which is by itself significant, especially considering that the proportion of people that are in first responders that are going to treatment is not twice the amount of the general population. I think it's an interesting contrast. And then the second part is substance use, right? And so we know that within EMS particularly, we have, drinking alcohol is almost kind of part of the expectation to some extent. At least back in the day, I remember we had parties, and it was definitely not something people frowned upon, and it was something that you were expected to do. You had a hard shift, you went home, you had a drink. And so drinking has always been kind of like intertwined. And then recently, we've also heard about a few cases. I know some that hit close to home, where we had paramedics and EMTs getting stuck in a situation where the narcotics within the ambulances were taken, and there were significant repercussions, right? So there's substance use can look many different ways.
Yeah, and there was a firefighter who actually overdosed in the firehouse last year and had polysubstance. I mean, it was, and again, I think this comes back to the idea that, one, as we normalize drugs and things such as marijuana, which, in Massachusetts, you can't really drive down the street anymore without smelling marijuana somewhere. And I know a lot of people think in their head, marijuana is just relatively harmless. You should think of marijuana. I do think you should think of marijuana much in the way that you think about alcohol. However, right, recognize that, again, it's not a harmless substance, and sort of all things in moderation, right? But recognizing that EMS folks, given the fact that we tend to suffer from, we have twice the incidence of depression and other psychological disorders, right? 20% of them have some form of PTSD, right? And then for certain sleep deprivation, right, that does put them at a higher incidence of substance abuse. And we're going to talk in a few minutes about what the administration, and I mean the Biden administration, is doing about this. But this is the one, from my perspective, that sort of is logical, but you reframed the way I thought about this, and literally it was like a light went off. And so I'd love you to chat about, I always thought about this in the context of, hey, they had a rough call, and in the context of being a caregiver, they lost a patient or did this really, really traumatic call. And that's that recent loss that, we talked about. But you framed it totally different for me. Or even, by the way, that they suffered, right? Someone in their family passed away. But the way that you framed this for me put it in a totally different context that sort of was like a light went off. So
yeah, so like, a lot of people think recent loss means a death of some sort, right? Either a death of someone you love or a patient. And in that context, the triad doesn't necessarily seem to work out in terms of being able to predict suicides. But what we need to realize is that loss looks very different in different situations. It could be a loss of status. It could be a loss of financial loss of some sort, a divorce, loss of, if you're used to working with a certain partner and you, for whatever reason, changes in scheduling or whatever, you lose the ability to work with that partner. Loss looks a lot of different ways. And I think oftentimes the loss part of the triad is the hardest one to identify, because we are like, okay, well, there hasn't been any rough calls, so doesn't seem like it should be a big deal. But like there's small things that could feel like loss and represent part of this triad that put together with, depression, the underlying depression and substance use. Again, it doesn't have to be serious substance abuse. It doesn't have to be someone that's, considered, everyday drinker. It's the combination of these three things happening at the same time that leads to a higher likelihood of dying by suicide.
yeah, and one of the things that I think I had never really considered, and this was this idea that, okay, someone's going through a divorce, that might sort of make sense to me, but this idea of, hey, a status, right, where you might be viewed in a certain way professionally or in your community, and suddenly for some reason that status has been taken away from you. Or the concept that, like, for example, I always tell people, when an employee of yours gets injured, you should at least talk to them about EAP, because again, I had at the time, back in the very early part of my career, I was a couple of years in, but I was working a whole bunch of hours, and I had done what most EMTs do, which is gross my lifestyle up to a number of hours that is not sustainable, right? 60, 70, 80 hours a week. And when I got hurt and I got put on light duty at 40 hours a week, financially, it was devastating to me. And as a result, right, certainly impacted my mental health and wellness. And so what I'd say to folks are, this was the one that led me to go like, wait a minute, right? Again, right? What if there has been my kids, and while I'm not a digital native, what I will say is something that might not really bother you as someone who's not a digital native, right, on social media, that sense of loss can be a social media sense of loss that you may or may not be aware of. And so this was the one for me that I was like, sort of changed my frame of reference. And
also,
go ahead, please. No, please.
No, I guess the other thing with that, think about the same stuff is, when you're thinking about, somebody that gets disciplined within, a crew that gets disciplined for whatever reason. And back in the day, we used to say they lose their wings. I don't know if that's still a term that people use.
Driving privileges.
Right?
Right?
The driving privileges are taken away. Like that change in status could significantly affect, our crews. And that's something that maybe we don't think much about. It doesn't seem like a big deal, right? Or when paramedics stop being allowed to give a certain drug for whatever reason, the protocols have been changed, and so they feel like now they've kind of like gone down in the totem pole, right? And so all of these things, like losses, could be very minute and yet have a big repercussion on mental health,
right? And can be stacking, right? As you sort of talk about, right? This idea that, hey, geez, maybe, again, what we usually say is it's sort of that death by 1,000 cuts concept, right? That it's a bunch of things stacked on top of each other that then create this, what really is this lethal triad. And just so we're clear, right? In that study, as I understand it, you said in a fair number of the folks who had died by suicide, they found this lethal triad existed. And so what we say to you is, again, you need to think about this in the context of your interactions with your staff and the way that you're managing your staff. If in fact your goal, right, again, is to keep your workforce healthy and productive. So this Surgeon General report, by the way, is lengthy. And what I'll say is there were a lot of elements in the report, and we want to focus more on the positive side here and sort of what you can do from an affirmative perspective. They this is one of those tools where, as we said, take this to your team, dissect this tool, look at it. It is a perfect or a very, very good roadmap for how you can frame your initiatives in your workplace around mental health and wellness. So I don't know, Lau, if you want to tackle sort of this diagram we grabbed on purpose. And by the way, happens to look a lot like Maslow's hierarchy of needs, which I hear a lot of managers talk about. Go ahead.
Right, and actually, it's even using the same word. So I think it would surprise me if they actually use the Maslow hierarchy of needs in a way to write this, because it's basically the same wording. But basically, there's 5 essentials that they find as specific areas in the workforce that that impact the well-being of the workforce, and also areas where we can do something about improving the well-being of our workforce. So the 5 of them are, protection from harm, and that is basically resting on 2. So each one of these essentials has 2 human needs that it is based on, right? So protection from harm goes with the need for safety, and the need for security, connection and community, social support and belonging, opportunity for growth, like learning, accomplishment, and these things, I think they seem pretty straightforward, right? Like mattering at work. I think mattering at work is one that it's worth for us to discuss further a little bit, but it's basically, like dignity is like the sense of being respected and valued, whereas meaning is like the sense of the broader purpose and significance of one's work, right? And I think, Scott, you mentioned that about saying, instead of saying you're saving lives today.
Right. Yeah. When people go what do you do for work? Or what did you do? And I go, I worked on an ambulance. And they go, oh, you saved lives. And I always had this maybe super uncomfortable, because I don't know that this is a reflection of my practice in EMS, but and the opportunities to actually save lives are very, very few and far between. But do you have the opportunity, if we were framing it more in the sense of you have the ability to touch and impact lives? I think that then gets you out of that imposter syndrome. The thing that I like, first of all, two comments on this. Maslow's hierarchy of needs essentially suggests that you have to foundationally build one on the other and get to that self-actualization. What I like about this diagram and the way this is laid out is they are interrelated, right? Rather than one is a prerequisite to the other. The other thing is, and this is what I like, another thing I like about the report is in each of these segments where they break out what these essentials are, there are links to resources that you can use as an organization, right, to be able to work on each one of these functional areas, right? And that's the part that, from my perspective, people all the time ask us, what is it that we can do? This is what you can do, right? These are the action items that you should walk away from this program with. So, and I don't, so connection to community, right? That idea that, right, you're that's the interrelatedness and the role that you're taking in the community, right? Getting at what is your social network and your sense of belonging, but recognizing that special role that I think EMS personnel hold in sort of their part of the entire, I'm not the psychologist here, but what I'd say is, to me, these are the areas that really do have a roadmap for what your organization can do to start to really tackle these.
Absolutely. I think the one that I think, especially in EMS, we think it's the hardest one, but I think it's going to be interesting to discuss and kind of find that there is even something we can do about is the work-life harmony, right? Because we know that, teleworking was not an option for EMTs during the pandemic. And so the two needs that work-life harmony goes is autonomy, which is control over how you're doing your work, and then the flexibility is about when and where you do your work. And I guess this gives me an opportunity to make, I want to make sure that we're emphasizing that, it's oftentimes, I think we get carried away in discussing EMTs and paramedics specifically when we're talking about the workforce. And it's also important, and the research also backs it up, that it's all employees within an ambulance company or within, first responder community. So we're talking about billers, we're talking about dispatchers, we're talking about all of these different people that are also directly affected by these things, and that we need to consider improving their their work experience as well. So just as we're speaking about this, I know we kind of tend to use EMT examples, but it's not just EMTs, it's everybody.
Well, and what I liked on that one, right, in the work-life harmony, one of the resources that are in there is like 5 ways leaders can support remote work, right? How we can grant employees more flexibility in their job positions. Again, what a lot of folks say is the job is what the job is. Well, a lot of people have essentially defined what working means and found flexibility within that. And again, to me, we're awful generally at work-life balance, but part of what people say they appreciate about EMS is the fact that you can do 2 24-hour shifts and have 5 days off a week. What percentage of our staff are actually taking time off? What percentage of our staff are using their PTO? What percentage of our staff, right? How are we celebrating or leaving our staff alone when they're not working, right? If I'm an EMT and I'm a relatively conscientious EMT and the pager is going off, and I say pager, which I'm dating myself, the text messages are going off incessantly that we're desperate and we need your help, you are setting your people up for an awful psychological position, because they essentially, if they don't answer the text, they are essentially ignoring your cries for help, which we are helpers in general, right? Again, and so I get a lot of pushback on this one of, if you have people who have requested time off, do not bother them when they're off, or create 2 types of time off. I'm time off, I'm willing to work if you call me. I'm time off, I don't want to be bothered. This is, my family vacation. And what I would say is, these are things that if you try hard enough, again, you can do. The last one that I say, and people really give me pushback on this, is if you're a leader, stop sending emails to your folks, text messages to your folks after hours. I do not care that this is 24/7, 365 business. What I would tell you is you can schedule your emails to go out or your messages to go out at a certain time. But when your people are off, do not put them in the conflicted position where they have to choose between their friends and their family and work. That's just not fair. Sorry, I don't mean
the message that it's also about the message that you're sending, right? Because you get an email in the middle of, like some off hour, and if it's you and other members of your team, and somebody else writes back and you don't, then you're constantly kind of feeling like you end up being at work 24/7 yourself, regardless, because you're trying to measure up, and the message is you're supposed to be on call, right? It seems like it, even though you're not getting paid.
Right. And one other comment that you make to that, and I, again, this is right. People don't, I put my phone on do not disturb between the hours of 11 at night and 7 in the morning, but not all of our folks do, right? And so understand, if that thing, like when my wife's phone is binging in the middle of the night, I want to throw it out the window, right? And it interferes with sleep. And we already know that sleep is one of the best first aid things that you can do for yourself. So again.
Well, and you're also touching on another thing, which, one of the largest problems with that goes on laws and everything is problems in relationships within the workforce, right? So you have like the husbands or the wives of EMTs that are being, that this becomes problems in the home as well, because there's an unpredictable schedule. So the more that you can make schedules predictable, the more you can allow free time to be free. And also the role model that the leaders do, right? So if you have a supervisor that works 100 hours a week, and it's and that's kind of what you were saying, Scott, earlier today, about someone that they give them rewards for how many hours they worked.
Yeah, kudos for, hey, we want to recognize Lau because she worked 72 hours last week. And it always helps out when the message that you're sending, again, right, is that we expect you to put company before self. And again, that balance is really, is really an issue. So again, I think it's, this comes back to, these are, and we're going to talk about atomic habits in a minute, right? These are small things that you can do in their accumulation, just like on the downside, in the negative column, small things that add up to create a problem. These are small things that you can do that can dramatically change trajectory. And, if you read the book Atomic Habits, one of the things they say is a 3-degree change in aircraft pitch when it leaves LA is the difference between Washington and Maine, right? And so what I'd say is, these are things that you have to just think about. Okay, you may not be able to do the grand things, but you may be able to do the smaller things. So
that's right. I don't know if you want to go, should we break it down now and kind of go into components and stuff? You want to
Yeah, I mean, we've hit two or three of them, and or if to the extent, I think you've hit two that are super, to me, right, mattering at work. This comes back to, again, 80% of our staff, right, are largely not encountered or engaged on a regular and ongoing basis. Now, granted, they may want to work sort of, as we used to say, run silent, run deep, right? They may want to run off the radar, but the reality is, there are ways in which, right, in many contexts in EMS, we often struggle with being recognized, having some sort of meaning in what we do, and getting dignity, not only from, we're not always getting what we would expect from people in public safety. We're not always getting what we expect for people in healthcare. And then we're not always even getting sort of what we would, some level of respect from the patients that we're taking care of. Right. And so, I don't know if there's another one that sticks out for you.
Yeah, no, I think, one of the ones that I kind of went on a rabbit hole the other day when I was like I was researching about it is, providing a living wage, right? And I know that that's a touchy subject in a lot of places. And I know that minimum pay, it has been a reason to debate for in a lot of ways. But one of the statistics that I saw the other day, and I was like, oh my goodness, is the high percentage of people that are below the poverty line working full time in this industry, right? And even food insecurity and situations like that. So even just like looking at like, taking a real look at pay wages and seeing if people are actually able to make a living without working those extra hours. What else? Also engaging people in the decisions of the workplace, right? So sometimes we change protocols, even something as minute as like the type of gloves that we use. People can have real big feelings about these things, right? Like the way they feel. And so sometimes just engaging workers in making these decisions together, even if you arrive at the same results, right? Maybe like, yeah, this ones are cheaper and they're just as good. And like, even though we like the other ones, it makes sense. Just having an understanding of why these changes are being made makes a big difference on the overall experience of dignity. And then also just building a culture of gratitude and recognition, right? Like this is not what EMS is usually known for. Like we don't go around patting ourselves in the back. So just kind of, being able to express to your employees that, that you appreciate what they do, like dispatchers working, all kinds of hours and the role that they play in the system of helping people and everything they do. Usually like EMTs will get it, but the billers are not getting recognized for the fact that they're also spending a serious amount of time reading reports that are traumatic and they're having an effect on them and recognizing them as well in some way, right? Yeah.
Well, so I think one of the things that, if we haven't stressed that enough, that Surgeon General's report, I think is certainly a must read. But I want to talk just briefly about the Biden administration and their efforts around sort of taking action for mental health and wellness in the workplace. And in particular, their angle has not only been through some of the grant monies and this, sort of the Surgeon General didn't come to that decision probably on his own, that this was sort of a larger administrative initiative. But the Mental Health and Parity Act, there were some very recently, within the last 2 weeks, there were some proposed regulations which would really increase the requirements upon employers as it relates to mental health parity. Now, the Mental Health Parity Act has been around for some time, and in sort of summary, what this act means is that a health plan and your health plan at your organization cannot place greater limitations on benefits for mental health care or restrictions on access to benefits on mental health care than you can on, than you do on standard sort of non-mental health related services. So essentially saying there must be parity between the benefit amounts and the benefit access for mental health that there is for other healthcare. Now, what the proposed regulations were going to require are an expanded parity as it relates for access to drug treatment, and essentially saying you need to make it as easy to get access to drug treatment as you do to primary healthcare or to other forms of healthcare. In other words, from a network adequacy perspective, because I know Lau and I in our roles on the Code Green campaign board, when we're trying to find services that are available that really, now this mental health parity isn't necessarily saying you must have a mental health counselor who has experience dealing with first responders. Our access issue, trying to find people who really do work primarily with first responders, is really, really challenging. And so what I'd say is this rule is going to not only require, broaden those requirements, but then also require that there be some analysis by the health plan as it relates to not only have those benefits been accessed, but because, by the way, that's a great indication to whether there is parity amongst health benefits with the mental health stuff, but also for drug treatment. So these proposed rules are out. The comment period is open, I believe, for another 45 days. Frankly, I don't think this is a terribly controversial. This is one of those ones that generally I think will fly below the radar, but it's important to understand if you as an organization are out communicating about your benefits, right? We often talk about, hey, what's it going to cost you for an ED visit, or what's a copay for a doctor's visit? One of the things that you should add to that dialogue, because just the fact that you're talking about it does bring it into the mainstream of healthcare benefits, is what access do we have for mental health? A lot of people will talk about EAP. EAP is often a stopgap to a crisis. Mental health benefits really can be an ongoing part of your wellness program as a whole. And then also talking about access to drug treatment. So there has been this renewed focus on mental health and wellness, we know, sort of globally, and in particular by our administration, right? And I spoke this week with a AAA member in Kentucky who is considering using some grant money to bring in a counselor into their organization. When talking with this person, he said, oh, no, we already take care of their food. All of their food is covered. We already take care of essentially their food and their drink during their shifts. We make sure they have access. I talked to another provider this week who told me, hey, we actually provide 3 loaner cars to our employees in the event that their cars are getting fixed or they don't have access to an automobile because some crisis has occurred or their car is broken down. Again, understanding, right? We're sort of rethinking the idea of mental health and moral injury. So I don't know, Lau, if you have any comments on things that you've seen that folks are focusing on, or that are available now that maybe weren't available to folks 2 or 3 years ago.
Well, I mean, I know for one, I think we heard the other day about, some people are actually bringing in clinical psychologists to work and provide treatment on site, which, sounds, obviously I'm biased on that topic, but I think it's exactly, an example of something they can do. And what was interesting to me is that this person was saying that it's actually much cheaper and less expensive than a lot of the other things that sometimes people do with trying to promote resilience and improve mental health. So there's been a lot of trying, but I think one of the things that like you said, Scott, that I think is important is to look into the benefits that you're providing and really check what is it that people are getting for mental health. Sometimes a lot of these health insurances are not really providing the needed coverage for mental health as they should be.
Yeah, and so one of the interesting things, the APA, right, put out the statistic that 43% of employees reported their employers offer health benefits with coverage on mental health. By the way, the Mental Health Parity Act says that you have to offer mental health services and you have to provide the same benefits. So this is a perception issue. And so this comes back to, right, communication. So we talk about those small, a lot of people are thinking, oh my God, I cannot possibly take on another huge project or another huge initiative. We're suggesting something, in fact, incredibly different. This comes back to an organizational top-down culture change, right? Understanding from the very first day, if you do not have a presentation or a discussion in your orientation program, in your interviews regarding mental health and wellness, frankly, you're not setting the stage for success, in my opinion, right? Again, this comes back to not only in your orientation, right? Your folks are getting bombarded on a daily basis when they're working with issues related that are going to impact their mental health and wellness. not only when they're working, actually, frankly, when they're not working. But you need to be addressing that not only on day one, but you need to be then addressing it as they move through their annual competencies. The one that I think often, again, statements matching actions, we care about you as the whole person here. We want to make sure that, psychologically you're in a good space. But by the way, can you please work? I know you've worked 70 hours, but could you please do another 10 or 12? Those things are not, they're non sequiturs. Let's put it that way. You cannot have, be speaking out of both sides of your mouth. So one of the things that Lau and I talk about all the time are that it is no longer expected that you're going to take care of just someone's professional well-being. And I know that that may not seem fair. It may not seem like it's your responsibility, but what the expectation is for a lot of folks entering the workforce today are that you're going to take care of them personally, professionally, financially, and socially. And so, this is one of the things that as you think about your wellness program, this is not one of those wellness programs that, by the way, a whole bunch of your people really don't participate in. And it's used as a function for making healthcare affordable for folks, right? This is one of those things where you need to be thinking about wellness from the other side of that equation. So,
and you don't have to spend a lot of money also to create these things, right? Because it sounds very daunting to say, oh my God, I have to take care of all these other aspects of the people. But like in reality, it's something as, and we're going to be talking about it right now, the sitting down with employees and having regularly scheduled supervision so that they're able to provide feedback, so that feedback goes both ways throughout the work day, throughout the work week, or whatever, however often you do it, right? Being able to, in small ways, you can make changes that are going to make a big effect in this.
Yeah, and I think also communicating, right? Changing the way in the mechanisms in which you communicate, because I think a lot of what people are sending out there right now are, oh my God, we're dying, we need help. We need help, we need more staff, or we're going to give you a shift bonus if you work because we're desperate, right? Some of it is changing that narrative. And so actually, the question just popped up in the Q&A that I love, and I think it's a great question, right? How do you address the employee who consistently complains about the pay rate, the lack of their financial stability, but who refuses to sit down with a financial advisor, totally free, who could suggest ways in which to change their spending style? I love that. All right. So good question. Excellent question. And what I say to folks are, you're never going to necessarily convince or drag someone over to that well. Whenever I brought in a financial planner, that I said, hey, folks, the financial planner is going to be in the conference room. It's going to be there every day this week from 1 until 5. Nobody walked through the door, right? So what I would suggest in this instance is, right, again, sitting down with staff. Number one, hands down, the one thing that drives engagement in the workplace more than any other thing is the relationship between the frontline supervisor and the manager. The reality is the persons that they're going to sit down with, they are not going to know, they're not going to have a relationship with, and they will have that financial planner, despite all their expertise, will have no sort of credibility, even though they have external credibility. Finding mentors, good field training programs, maybe I've never, ever yet been to an ambulance service that has in their orientation program, a presentation that talks about, hey, you're entering into the field of EMS, not always known for its great wages. But here is a path that many EMTs and paramedics take that put them into a predicament. Don't be that person, right? In other words, you're going to work numerous hours. You are going to gross your lifestyle up to an unsustainable demand for your work. And so possibly, to Chris's point, making sure that you talk about the fact that when folks come to your organization, this job didn't change the pay rate halfway through the profession, right? It has always been this pay rate. And frankly, wages are up between 25 and 30% over the last 5 years. Wages will not be the solution. When you take a look at this year's Newton 360, AAA Newton 360 turnover survey, out of the 4 categories of people or groups of workers that they looked at, EMT, paramedic, supervisor, and dispatcher, only one of them was the primary reason pay and benefits, right? Only one. So recognizing that, in fact, that is not the primary thing that are causing people to leave. So to I can't suggest that you're going to motivate that person who just refuses to change behavior. However, right, you could potentially model, you could potentially create models that show them how to be successful and how to not get in that position in the first place, right? Here, you're coming in to work this month. Here's what the average EMT makes. Here's what happens if they work overtime. Here's a way in which you can self-fund your own financial exposure, right? In other words, some companies use things like HSAs and other flexible spending arrangements so that you can sort of self-insure your own deductible. What I'd say to folks are building education. Folks are using things like, and why I'm Dave Ramsey, right? Oftentimes the people who have used Dave Ramsey have had great success with that. So ongoing employee engagement, monitoring those behavior and interaction. And then this is one that Lau and I talk about all the time, something as simple as having as they clock in and as they clock out, how are you doing, right? You can use smiley faces. You can use this icon down at the bottom where essentially you're saying, hey, I'm doing great. Hey, I'm not doing so great. I know that may seem like some sort of very simple, almost sort of nonsense kind of thing. But what I will tell you is for certain, right, those are ways in which you can start to assess. The fact that you're asking the question tells people what you value. So
right. And I think just to piggyback on that, I think, we're used to having checkoff lists for the trucks, right? And like we make sure that we have all the right tools that we need to go throughout the day, and maybe having a people checkoff list, right? For the crews, like, do they have enough water to stay hydrated? Have they got enough sleep? Do they have food? To basically something that just like they have to do at the beginning of each shift. So just at least check in with each other to know where their partner's at and how they can make the day go by better.
Yeah, and I think it comes back to, again, education and training, right? That idea of shifting the focus of what it is that the end goal is, right? What are we trying to do here? We're trying to change lives. We're trying to impact lives. We're not trying to necessarily save lives. That is it's wonderful when it happens, but it's not very common. Not just your frontline employees, right? We often focus almost entirely, when we think about EMS week, a lot of times we're handing people coolers and stuff like that. Well, your folks who are working your billing officer and your dispatch, frankly, cooler doesn't resonate with them. And there are very few people who are like, this place is awful, I'm holding out for the free hot dog I get during EMS week, right? The fact of the matter is, not everybody handles stress the same way. Not everybody values things the same way. And again, recognizing that the communication has to be tailored to different groups of people, right? What speaks to a 20-year-old is not going to speak to a 40-year-old. So making sure that you understand that as well. And the one thing that I will say is that I hear often is your most likely work-related injury, whether you realize it or not, and whether it actually formally costs you money in your workers' comp, is a mental health related concern. So one of the things you could do is, we're sort of wrapping it up here, and I know we only got one question, but one of the things that we're wrapping up, right? Rest and break cycles. One of the things are, if you are not tracking how often your people are in fact getting rest and break cycles, or what time they're getting out, or essentially what percentage of your folks are actually utilizing their paid time off or their time off, again, those are opportunities for you to understand and, by the way, publicize, because the frame of reference, hey, just so you know, everybody got a lunch today. Hey, just so you know, 90% of our workforce got a lunch today, sends a very important message out to your teams that say, one, we're measuring it because we care. Number two, and they will fill the narrative. They're like, no, I didn't get a lunch. That means nobody got a lunch, right? Now, I understand what you're saying was, well, I get a lunch. Why was I the only one who didn't? The fact that you're measuring, right? If you're saying to people, we're going to communicate these things so that we're letting you know that these are things that are priorities to us, that your work experience is critically important to us. That idea of taking care of their nutrition and water, I know not everybody can afford to do that, but I will tell you, this is one of those ones that you will be amazed. When I check into a hotel, which I do more times than I can count, and I get 2 free bottles of water, believe it or not, I think far more positively about staying in a hotel at that hotel than I do at any other. Exercise, of course, meditation is certainly one. And I say of course, because frankly, I think many people practice a form of meditation, but that's not what they call it. And then this idea of a partner check-in and discussion, right? Talking to staff grabbing even them as a partnership and saying, how are you guys doing, right? How is it going?
Talk to them at times other than when they're getting disciplined.
Right. Because that's the majority, right? The majority of times that, or the most amount of time that a supervisor is generally getting to coach and mentor people, and by the way, that coaching is usually in the form of discipline, is somewhere around 6%. And I like the idea of, I know Dr. Russell, a longtime AAA member and frankly, volunteer leader, hire somebody in who comes in relatively short money. I think he said it was like $5 or $6 grand a year. Has someone come in and actually sit with the staff, and from them, they can then go out and refer out. But just so we're clear, again, he said it has made a huge difference. Looking at and making sure you're communicating again. By the way, this horse, probably all 4 legs of this horse are in the air by now. But Amanda did a great job at really one of the things she's worked on over the years. And this one she set up a long time ago was the counselor match, which for many of you know, Jeff Dill, amazing guy. Formerly, this was an EAP program. We use something called counselor match, where Jeff's group generally has those people who are vetted, who have experience with people in a public safety space. Of course, these other resources here, which are available on the AAA members page, Code Green campaign, which Lau and I thankfully get an opportunity to serve on. And then lastly, of course, the 988 line, which we were all very worried about how this was going to turn out. But thankfully, I think it has turned out reasonably well, because at the time that this was announced, there was not a good plan for implementing this. But, what I want to say, one, is thank you to Dr. Morrison for sitting with us again, but also to you guys. And what I'm really, really interested to hear is, I have this desire at some point to hold open dialogues with attendees, like an open Zoom meeting. And I know that can get away from you pretty quickly, but I would love to get, Dr. Morrison has committed to, she's volunteering now on the Professional Standards Committee for the AAA, all on her own, because we asked, and because she has a love for this profession. How can we best present material like this to you? What support can we provide that will help you in your organization and your workforce ultimately? So we'd love to hear back from you at hello@ambulance.org. And what I would say is, and I know I'm sure I'm not saying this out of turn, Dr. Morrison's email is up there because she literally, we were passing emails at 11 o'clock last night. And what I would say is, if you want to reach out to her, please do. But Lau, thank you so much again. This is what, 4 or 5? I know you did an annual conference for us as well. So yeah, so I can't thank you enough. Yeah, really, really appreciate it. And with that, I'm going to pass it back over to Amanda to close us out.
Thanks again for joining us this afternoon. We will archive this webinar to the AAA YouTube account and then post a link in the on-demand section of our website later this afternoon. We'll also email out the recording in the digest tomorrow morning. We look forward to seeing you at another AAA webinar soon. Thanks again for your time and participation.
Thank you.
Thank you.